I would say people that the average deductible for a ACA policy is $12,000 per year. That's not access to health care. That's catastrophic insurance that doesn't work, and that's why our accounts receivables have went up exponentially. And oh, by the way, the emergency room visits have went up exponentially as well under the Affordable Care Act. I wish it had worked. I wish I was focused on national security and immigration and tax reform and growing this economy rather than having to deal with this. I wish that the ACA had worked, but it's simply broken and we can't go in this direction. Doing nothing is not an option.
Under the ACA, $7,500 is the most deductible. Not $12,000.
And that's actually cheaper than on the private, on any kind of private market. The ACAs are less. And so the cost curves, if you look at the cost curves, they actually have been down since
Your
2010.
HHS secretary said that what's wrong with having $20,000 deductible?
Not to mention, President Trump promised universal health care for all.
No, he didn't.
September,
I don't want to
September 27th on 60 Minutes, he said everybody's got to be covered and the government's going to pay for it. That's exactly what he said on September 27th when he was a candidate. That's what he promised. That is not at all what was presented, not even close.
Can you promise that your constituents in this district will not lose their health care that have it right now under this plan?
You know, I don't really want to turn this into a me versus you. I think at the end of the day that healthcare will be better, more affordable, and more accessible when you add it all together. You have to look at more people's eyes than just yours. Having $12,000 deductible is not like having insurance at all, and the top deduction I think actually goes to the tax credit goes up to $14,000 for a family, by the way. I'm going to first address his questions about my statement, and certainly my statement about the poor was taken out of context. I've made a lifetime out of helping people. Every time there's a hospital writing off money, there's doctors down there doing the work as well, and I've stood right beside him. Was the only OB in 70 miles that would take Medicaid as a payment for OB, and I spent many nights up all night taking care of people without insurance or Medicaid. What I was trying to say is this, is that Jesus said the poor will always be with us. And what I was trying to say is society has an obligation to help those, but it was taken out of context. And just like society has an obligation to take care of the poor, physicians, hospitals have an obligation to take care of those people as well. We always have and we always will. And secondly, I was trying to say, so often people with Medicaid use the emergency room as their primary care doctor. And it drives up costs and it burns out physicians. That's all I was trying to say.
Poor people avoid the doctor and use the emergency room as their primary care because that's what they can afford. And at the point of going to the emergency room, there's no other option. It's an emergency at that point. If they could afford to go to the doctor beforehand, they would have. Sorry, just want to comment.
No, thank you, and I agree that's all true, and that's why we need solutions. The system is broken, and I want to talk about solutions. So one of the things we want to do in this bill is we're going to fund more federally qualified clinics, health departments, to help those people get access to care.
I can give you many anecdotes about patients that for a $100 bottle of insulin, we could have prevented a 5-day ICU stay. And that comes down to access. And I read your handout on the numbers, and I'm concerned because the big number that's not listed there is the number of people that are going to lose their insurance if this is repealed. And we have to think about that. And I'm a proponent for Medicaid expansion as well, but this is not even counting Medicaid expansion. This is the people that will lose their health insurance. We're talking 20 million people in the United States. So please, and I supported you. I thought, here's a man who has common sense and compassion, is going to be able to understand these issues and bring insight to other members of Congress. So I implore you to do that. There needs to be a component of that. There needs to be some safety protections for the folks that have insurance, that need insurance, and need to keep that and don't just get left behind. And I honestly don't understand this tax break for the very, very wealthy in this country that comes along with this bill. And so I'd like for you to speak to that a little bit. And I guess I would ask you to wait for a more considered bill that has more solutions up front. And I understand the legislative process, I understand how things work through, but I think we need to have a more considered bill. So
Under the mandate, and that's what I want to talk about today, is that there are so many illusions of words. that is put out there by this bill. Okay? Accessibility, affordability. You hear the word accessibility, they don't mean the same thing. I have the accessibility to go buy a Lamborghini. I have the accessibility to go buy a BMW. I don't have the affordability to buy those things. Okay? I have accessibility to great health care here in Southwest Kansas. I don't have the affordability if I can't get health insurance. And this plan, Let's Make America Sick Again plan, does not give that affordability. If you're a $25,000 hardworking person in this county or in this state, you're going to lose your health care because your premiums are going to go skyrocketing compared to what the ACA has. If you're 50 years or older, your premiums, if you're a couple, 50 years or older, could go up almost $17,000. It's ridiculous. Who benefits from this thing?
This does not feel like repeal and replace to me, and I know that's the headline. We are honestly trying to take the good things of it and keep those and then fix with other parts, but it's not perfect. There's going to be more work to be done. So the most important things people wanted to keep, people talked about. So you're not going to lose your insurance because of pre-existing conditions. We've kept that. We've kept the donut hole closed. We kept children on their health insurance till age 26. We made it so women cannot be charged more for health care than men simply because they're a woman. So I think we have tried to accentuate the positive. But going in the direction we're going, we cannot afford to keep doing this.